Imagine a fuel tank that refuels faster, a brain that stays sharper under pressure, and a strategy that's going to work across the board for all ages. Guess what? Creatine is that fuel. So let's break it down and talk about who this is going to work for and who should actually even consider it. Creatine daily use can offer several potential benefits for both men and women alike. Of course, there's also going to be some specific considerations that go above and beyond what we know for brain health and women's osteoarthritis risk. You want to try to prevent osteo as a woman, make sure you have creatine on deck. You have osteo, get creatine on deck. And now, at a highly intake of around 20 grams per day, the cognitive enhancements in this are robust. And those, though, with kidney issues should definitely take heed, and you need to be on a lower dose, and you need to be mindful and check in with your doctor and watch what's going on with your kidneys. Doesn't mean you have to cut it, but you got to watch. And this is going to bolster brain energy metabolism, right? And particularly in situations of sleep deprivation or an acute cognitive load. And once you do, it's going to be helping with your tasks, requiring quick thinking, memory and attention, stuff like fatigue, people of older age, lower baseline cognitive reserves. You know, this is a universal enhancement at the same time. And if pursuing cognitive goals with high dose creatine, it is suggested to make sure you talk with your doctor and keep in mind appropriate monitoring of your kidney function for those with kidney conditions. I'm saying it again because it's very important. It doesn't mean you have to not do it, but you got to be mindful, okay? And most importantly, everybody needs hydration. You're on creatine, you want to hydrate and push this through your muscles. For women's osteoarthritis, men included, the evidence base for creatine and it is all about the systemic effects and muscle mass, strength, and function. And in women, regular creatine supplementation of like 5 grams a day for maintenance, combined with resistance training, can help preserve or increase lean muscle mass. You're going to be improving strength and support functional tasks. Benefits that can indirectly ease joint loading, enhance mobility, and potential reduce pain related to osteoarthritis, which I'm suffering from, through better support and balance. And I have to say, it's definitely benefiting me. Some data suggests that the higher dose regimens as well can boost your muscle stores by far. So I'm averaging at like 10 grams a day, and my restless nights, or if I wake up feeling sluggish cognitive wise, I'm hitting 20 grams right off the bat, boom. And it makes a difference. It makes you feel like you're actually rested and you're sharp. We're now seeing incredible results even with 20 grams a day in dementia patients. They're getting amazing results with their symptoms. And so this is something to think about, right? No pun intended. Lately, creatine's supporting muscle growth by replenishing your ATP. That's your energy currency in your body, so this is huge. It's going to help deliver high intensity activity. It's going to help your brain train harder. And this is going to build lean mass with resistance training, right? Can't say it enough. Resistance training is the best training. And this can also help with nervous system function. Reason why, it's going to supply energy and neurons on demand, which is going to help your cognitive tasks when fatigued. It just all works together. Connective tissues, improving energy, supplying the energy to go to tendons and ligaments for support, collagen production cells, potentially supporting collagen synthesis, which is huge for me, for my osteo in my spine, and of course, going to have consistent resilience training. Combined with these effects, it's going to contribute to stronger muscles and better over structural support, which is going to help me take the load off my spine. And also the osteo in my knee. This is going to help people dramatically in these cases that haven't had the support. Let me tell you, and I mean it when I say it, I love creatine. All right, we'll see you next time.